Welcome to everyone who decided to give up a Thursday night of their lives to listen about menopause. And I think you only did that if this was important for you to do as well. So menopause is not an illness or a medical condition. It's a completely normal life event for women. However, over the years, it also means that the symptoms that women experiences can often be sort of under-recognized, undervalued, and perhaps not taken seriously. So thank you for joining us. Let's tease this out. So I think with the help of celebrities like Davina McCall, for instance, menopause and its symptoms and the treatments have been highlighted. And I do hope that the guilt and the fear and the kind of things of, I will just get on with things, will dramatically change for ourselves and for our future generations. The stigma around women just having to pull themselves together should end, and really must end. The stigma around menopause is seen in women themselves, so us doing it perhaps to other women or to ourselves, but also in men, and it affects all parts of our lives, including our workplaces. I've really have first-hand experience of the menopause. This is a subject that's very close to my heart. I started losing my mind at about 45 years old. I felt really anxious all the time. It felt like something was sitting on my chest. I couldn't sleep and I really struggled to concentrate to do my job. I would often forget to log into my computer. So for those who use a computer, you might know how many times you put in your login into that computer. I started saying no to anything socially, so I just didn't feel up to it. I didn't feel confident. It didn't really help that none of my zips could close on my trousers, so my clothes weren't fitting in the same way. Luckily for me, I had some really good friends that saw beyond this, and they saw that I'm not acting normal. And way before I knew it, they pointed out that it could be the menopause and really encouraged me to go and speak to my GP, which I did. And I was really relieved to felt listened to and understood. I did try and see a lady doctor, which I felt was more appropriate for me, because I was a bit scared that they might not listen and judge me and just say I'm depressed or put me on antidepressants or whatever the case might be. They did do some blood tests for me at that stage because they felt, she felt I was very young to go through the menopause. And it came back that I hardly had any estrogen in my body. And I started on estrogen patches, and within 6 weeks, I started to see a really big difference in how I felt. And ever since, it's just improved. So I've been on it for 2.5 years, and I can't imagine a day without an estrogen patch. So one of the things I would like you to remember through this talk and through my experience is that sharing your experiences is really powerful. It can help, for instance, our daughters, our future generations, friends, family members. So since my experience, I spoke to my mom and said to her, oh, this has happened to me. Has something like that happened to you in your life? And she's like, yeah. And she had a hysterectomy at 40 and then experienced menopausal symptoms then. And I don't even think she realized that. But I remember my mom as always being very grumpy, very sleepy, you know, just someone who's not really nice to hang about with up until I probably left home. And thinking back now, that's probably her going through the menopause and also not understanding it and not having the right support in place. So as women, I think let's create a generation where we know our own bodies, know who we are, know how to take care of ourselves, stop pushing through the difficult life-changing circumstances that we experience as women, and have lots of empathy for our fellow generations to come. In the chat of this webinar, I have put some really useful websites. So sometimes You need to rerun things in your head to really get it stuck in there and really know. And I think knowledge is power. So if you think something is up with you and you want to know more, go get that knowledge and then go speak to a healthcare professional with a sense of knowledge already there. So please have a look at that really useful, very patient-friendly kind of websites that explains things really easily. If you want any sort of additional support after this. So I've put a kind of a few aims of the session on there. So this first bit is going to perhaps look at the sort of the medical reasons of menopause. So we're looking at the stages. So what's the different stages of menopause, the role of these hormones that is playing havoc, the causes, possible causes of menopause, the diagnosis and symptoms of it, and HRT. And then, like I said, in the chat, there's some resources for you to look at as well. We have decided to make this a series because I think there's so much information. If we break it up into kind of the stages of menopause, and then the next bit, we'll look at perhaps what we can do to help ourselves. How can we help our waistline, you know, our sleeping, our mental health as well. So that's the bits that will follow after this webinar as well. The menopause is influenced by changes in our hormone levels. When a woman is fertile, her ovaries produces hormones called estrogen and progesterone in response to other hormones that we release. All of these hormones interact as part of the monthly menstrual cycle, which results in the development of an egg in our ovaries. As a woman gets older, the store of eggs in the ovaries decreases, and so does our ability to conceive. Less and less estrogen is produced, causing the body to behave a bit differently. The body does not stop producing estrogen overnight, and the process can take several years to happen. For all women, the menopause is an individual experience. For some women, the loss of reproductive ability might be deeply upsetting as well. So that empathy is very important. The years leading up to the last period, when women might be experiencing some menopausal symptoms, is called the menopause transition period. Women can experience vastly different symptoms throughout the menopause. So it's important to treat that treatment is really tailored to reflect the individual's needs and your changing symptoms. So speaking to your healthcare professional to look at your circumstances is important. So let's look at what's the different stages of the menopause. So you get early menopause. So early menopause happens normally before 40, and it can also be called premature menopause. And the medical term for that is POI, which stands for premature ovarian insufficiency. These terms might be used interchangeably, which could be confusing for some. So to clarify it, early menopause is used to describe menopause before the age of 45. And premature menopause is below the age of 40. However, premature menopause can happen to anyone below the age of 40, even to teenagers. During this time, your ovaries may stop working, leading to a drop in estrogen and progesterone hormones, and this can lead to a variety of symptoms, which we'll talk about further. Then we got the perimenopause. That's another phase. This is the start of the transition towards menopause. So when the number of the eggs are at a low level and the ovaries stop producing the female sex hormones. Although each woman's experience is different, during perimenopause, most women will find it more difficult to become pregnant and might get very irregular or heavy periods. However, it's still very possible to become pregnant during perimenopause. The medical risks associated with pregnancy increases a lot during this time. So if you want to avoid unintended pregnancy, the right contraception is really still required. So don't think if you're in perimenopause, you can't get pregnant. The perimenopause begins some years after the menopause itself, some years before the menopause itself, as the ovaries gradually begin to produce less of the hormone estrogen. It usually starts a few years before our last period. The perimenopause lasts up until the menopause, so the menopause follows on. How long the perimenopause lasts depends on that individual, so there isn't like a cut off, you start there and you end there. This can be anything from months to years later. The next phase is menopause in itself. This is when a woman stops having a period and her ovaries lose their reproductive function. So at this stage, you probably won't get pregnant. This is sometimes called going through the change. Menopause usually occurs between the ages of 45 and 55 in the UK, and the average age seems to be around the age of 51. For 10% of women, symptoms can continue up to 12 years from the perimenopause to the menopause, so that's an awful long time. The next and last phase there is postmenopause. This time of a woman's life following the menopause is called the postmenopause. So that's after you've been through the change. A woman is considered postmenopausal if she has not had a period for an entire year, so 12 months long. At this point, a woman's transition into a non-childbearing years is complete. Postmenopause lasts for the rest of your life. During this time, many of the bothersome symptoms of that a woman might experience before menopause gradually decreases. However, the permanent end of a woman's period doesn't necessarily mean that all these symptoms are gone. Along with the physical changes that occur after the menopause, postmenopausal women are at risks of a number of health conditions, such as osteoporosis and heart disease. Even if you are postmenopausal, getting regular checkups and preventative screening tests are really important. So please go for your MOTs at your doctor. How often you need checkups will depend on your health history. So make sure that you are in contact with your GP surgery for that. Attending your regular mammography and blood test, which will screen for things like diabetes and high cholesterol, is important. Osteoporosis is much more common in women after the menopause, so in the postmenopausal phase of your life. Risk factors for osteoporosis is if you have a close relative like a mom or a sister that's got osteoporosis already, if you're smoking, or if you have a slender build. So speak to your healthcare professional if you're worried about your bone health, because there's much prevention we can do for that. Perimenopause and menopause affects women of all ages and are currently responsible for a huge loss of talent in the workplace, as well as an estimate 14 million workdays lost in the UK per year because of the symptoms that can arise from menopause. So many individuals do not realize they are perimenopausal or menopausal, and I can vouch for that. But these symptoms, and it's so easy to put your symptoms down to things like stress, tiredness, or just the day-to-day pressures of life. So talk to a healthcare professional, know your own body, know when something is wrong. So I've put this diagram in there just to kind of show the flow of the menopausal stages. So what's the causes of menopause? So like I said before, menopause is not a condition that just affects older women. It can affect women in their 20s, their 30s, their 40s. It could also affect trans men and some non-binary people as well. The menopause affects everyone indirectly, as you will most likely live with, love, and work with people going through the menopause at some point of your life. Although it's usually a natural process, the menopause is a hormone deficiency with health risks, and there are safe and effective treatments that can help you. Perimenopause and menopause should not be considered just a part of your life and something you have to put up to. Once the hormones are low, they stay low forever. It's not a transition that you have to pass through and then all is well. It needs treatment. Some people have symptoms for decades afterwards, and the health risks such as osteoporosis and cardiovascular disease are applicable to all and go through to all that go through the menopause if hormone replacement therapy is not taken. So it's really important to look after yourself. There's other causes, so secondary and primary causes of menopause. So some of that can be sort of things like hysterectomies for various reasons, either having your ovaries removed or not. If you had your ovaries removed, that causes early menopause as well. If you have radiotherapy to your pelvic area as a treatment, for instance, for cancer, if you have received certain types of chemotherapy drugs to treat cancer as well. If you have a medical or surgically treatment for endometriosis or premenstrual syndrome, that can cause early menopause or menopause in itself. And some genetic and autoimmune factors can contribute to early menopause too. So yes, it is growing older, is a cause, but there is some surgical and medical reasons as well. And it's really important to be aware of that. So what's the role of estrogen? So we talked about estrogen and progesterone and the role of that in the menopause. So I thought I'd just kind of explain what estrogen does. So estrogen is the major sex hormone in women, and it impacts more areas of our health than you might even realize. It goes beyond fertility and sex-related functions to things like mood, bone health, and heart health. So estrogen is really important for healthy development of our bones. So it regulates our bone turnover in your adult bones and protects against bone loss. In menopause, when estrogen levels fall, women can experience a significant increase in bone density loss because of the protective effect that estrogen has on our bones, leaving us when that estrogen levels drop. This dramatic increase in bone loss can lead to things like osteoporosis, which can put you at a greater risk of some things like bone fractures, especially hip fractures as you get older. Estrogen also plays a big role in protecting against heart disease. It keeps your blood vessels very healthy, including decreasing the inflammation and controlling your things like cholesterol. The positive effect of estrogen on the prevention of heart disease is significant in premenopausal women. In menopause, when the protective effect of estrogen is gone, there is a steady increase in heart disease in women. So again, being protective, like I said, making sure you see your healthcare professional or your GP to check out things like bone health and heart health and cholesterol levels are really important. Estrogen also plays a role in boosting your brain health. It is thought that estrogen levels affect how your brain structures are connected, so how your physical brain looks and works, and how your brain cells communicate, and even the shape of your brain is determined by estrogen levels. Additionally, estrogen plays a big role in your mood because it strongly affects your a chemical in your brain called serotonin. So serotonin is the happy hormones. Serotonin is a mood balancing chemical, and estrogen promotes its production. So that means as we go through the menopause and your estrogen levels starts to drop, you don't produce all that serotonin or happy hormones, and it can really make you feel quite low in mood and down. It can lead to depression as well. So that can be a consequence of this really low estrogen levels. So again, having the right treatment can prevent all that. Estrogen also plays a really important role in our collagen production and our blood flow, which really helps a healthy skin. So this leads to smooth and a firm appearance of skin. That's what estrogen does. So As you go through the menopause and your estrogen levels drop, so does the collagen production in our body. So without adequate collagen, the skin loses its elasticity, and you can develop the appearance of fine wrinkles. I know certainly for me, I had extremely dry skin. I could put cream on all day, every day, the best cream money can buy. And by midday, it was just, I was flaky. So it really can affect that sort of how dry and how healthy your skin is. The next hormone I thought we could look at is the role of progesterone. So progesterone is one of the two female sex hormones that starts to drop as we go through menopause. And its main functions are regulating menstruation and supporting pregnancy for females. But it does some other things as well. So it helps keep our bones healthy, the same as estrogen, so it works alongside estrogen. It can help reduce our mood changes as well, so our mental health is supported by progesterone. It can prevent things like migraines or headaches. It can help regulate, it regulates periods for us, can reduce the things like side effects like hot flushes, and it can support you to sleep better and have that better quality of sleep as well. So looking at kind of the symptoms associated with menopause and all these stages of menopause. During your perimenopause and menopause, hormone levels fluctuate greatly. And this imbalance can result in a range of symptoms. And like I said, everyone's different. So these symptoms can range from very mild to quite severe and really affecting the way you function on a day-to-day basis. It can be from hot flushes to aches and pains to severe migraine, to severe mood changes as well. So 3 out of 4 women experience symptoms during the menopause, which can affect both their home and work lives as well. We do see that a lot of people go through really difficult relationship phases when menopause happens, especially if you don't understand yourself, what's going on for you, and perhaps have really a struggle with mood swings. It can affect your partner and the people who lives with you, your kids, and relationships can be damaged. So just watch out for that as well in your own lives. The severity of symptoms can vary from one person to another, and the length of those time that you might struggle with that symptoms can also vary quite a lot. Symptoms may overlap with depression, for instance, sleep issues, sexual issues, appetite changes, and low energy and poor concentration. So these things might you might come across that if you do struggle with depression. So if you've been diagnosed with depression, you might think, oh, it's my depression, and forget that it could be menopause, because you could have both at the same time. So it's so easy to put some of these symptoms down to something else rather than going through the change. And that means you never reach out and get the appropriate help through your menopause stages. Medication side effects can have an impact on the diagnosis. For instance, if you're using antidepressants like citalopram, sertraline, fluoxetine, they can cause things like insomnia, tiredness, and sexual dysfunction as well. So meaning, again, they mask the symptoms associated with menopause, and again, maybe leading to not reaching out for help. So identifying whether your symptoms are caused by menopause can be really confusing, as I've just sort of talked through. So many women may delay getting help for their symptoms because of this. And so hopefully this webinar would sort of highlight some of that symptoms that you can look out for. And I would say rather go and talk to a healthcare professional than thinking I just need to cope with it. Even if it's not menopause, then it might mean that you might need a treatment change or something else is going on for you. There's over 30 recognized symptoms of menopause, so a lot more than you might think. There's some really common ones, which I'm going to go through with you tonight, but you might find that these things that's not normal for you that might be attributed to menopause. I know certainly some people have also complained about really dry eyes and not being able to focus. And again, you might just think, is that because I'm not sleeping very well, or I'm feeling quite warm every now and again, got this hot flush? Is that the cause of making my eyes going funny? So there is a lot of symptoms related to menopause. And hopefully, if you can look at some of that websites that I've put in the chat, you can maybe see if there's other things as well. Some website has a symptom checker, so you can put your symptoms in there, and it can help you to distinguish, and maybe that can support you in that conversation that you can have with your healthcare professional about menopause and you. You may wonder why menopause has so many symptoms, and it's really because of that estrogen and progesterone levels that start to drop. As you can see, both those hormones plays an important role in a lot of our bodily functions. And when they start to drop, it does affect a number of things in our body. So let's look at some of these symptoms a little bit more in detail. So period changes is one of the first things people might see, sort of either having really irregular periods, either very far apart or very close together, very heavy bleeding, just some spotting. So any sort of period changes that's not normal for you. So perhaps having a period checker, maybe putting a little bit of a diary and keeping, on a calendar, making some, tracking what's happening for you could help you a lot with understanding and knowing when to go and reach out for help. And for those perhaps who's got like a coil in for maybe for contraception, you might not have periods. I didn't have periods, so that's why I didn't even think about menopause. So it might be that sign wouldn't be there for you. So you might have to rely on other things. Hot flushes seems to be a very common side effect of menopause, and it can affect 3 out of 4 women with menopause. Hot flushes can come on suddenly and at any time of the day, and it can spread through your face and your chest and your body, so people feel either really warm and they can go bright red as well. For some women, this might last just a few moments and then it's gone, and for other women, this might last for several minutes before you start feeling better. Hot flushes can be associated with symptoms like feeling very sweaty or sweating a lot. Some people can feel quite dizzy when a hot flush comes on. You might just feel very wobbly, or you get heart palpitations, so you're feeling your heart beating in your chest, which is not a really comfortable feeling. Night sweats is another one that seems to be quite common. So many women wake up and they feel, that their pajamas and the duvet and everything is just drenched with sweat. And this can lead to disruptive sleep for you, but as well as for your partner if you share a bed with someone. I've heard of ladies, having to get up and changing the bedding, or sleeping, naked underneath a fan on a towel because they sweat so much during the night. It's really uncomfortable and can really affect. And we all know if you don't sleep well, the next day isn't going to go well for you either. So it's just a vicious circle. So night sweats is quite common and something that is really disruptive in your day-to-day life. Mood changes can happen as well, very common. Some women who suffer from mood changes find they can be very disruptive to their work and their home life. If you're not yourself and you're reacting to things that in the past wouldn't have even bothered you. You could be very reactive, like immediately blow your fuse, or perhaps be very teary and emotional about things that really in your normal day-to-day life wouldn't have even fazed you. So you can see at work or in your family life how that can be very confusing for people at the other end of it, but also very confusing for yourself. It's not nice not knowing how you're going to behave in a certain circumstances, and it's also not nice if you know you're not behaving like you would normally do. So it's quite difficult to get over that. It can feel like permanent PMS. So for those who struggled with premenstrual syndrome when they were a teenager, it feels like that permanently over that. For me, like I said in the beginning, anxiety was rife. Everything was going well in my life, a good job, kids were behaving, hubby is absolutely supportive and lovely, no issues in my life, but yet I had this anxiety and this thing in my throat that I couldn't swallow, and I felt on the edge the whole time. So, and I was lucky because the rest of my life was relatively plain sailing. And I think if you struggle with that anxiety through the menopause, and life is nasty and it's throwing all sort of stuff at you, I can just imagine how hard that must be. And again, it can mask the menopause, isn't it? So if life is being a bit cruel to you, you might not think that this severe anxiety is due to the menopause. You might think that's just because life isn't being very kind at the moment. Fatigue and poor sleep. This can be related to the night sweats, as I already explained. Also anxiety and hot flushes. So anxiety can really affect your sleep pattern as well. However, you might be feeling more tired during the day, and this can affect maybe you if you're in a position where you can take a daytime nap. So you might take a nap and then struggle to sleep at night again. So it can lead to a complete poor sleeping pattern as well, which is something you need to rectify when menopause is treated. Brain fog. So this is a really collective term for symptoms like memory loss, where you just feel like I can't remember. You can't remember your best friend's name. It can get quite bad. Poor concentration, like where you could normally just do stuff. You could read a recipe and bake a cake, and it just works. Where some people can struggle to follow a recipe to make a meal at night, to struggle to follow a conversation. It could be really detrimental to yourself. It could be also really difficult taking and absorbing information. So your brain feel a bit like cotton wool, like you're just not all there. Brain fog can not only present a challenge for you at work, but also in the simplest of tasks, really. Like I said, just kind of reading a book or listening and following a radio program or a movie, or like I said, even a conversation. You kind of just feel like your trail of thought is going away. Loss of sexual desire is also quite common in the menopause and perimenopause phase. Feeling tired doesn't help. Having a low mood doesn't help. And the night sweats on top of that really doesn't help either. There's also a hormonal reason why you might not have a sex drive. Women have testosterone as well as men, and this hormone can influence our sex drive. So testosterone levels tend to decline with the estrogen and the progesterone as we go through menopause. So our testosterone levels also falls, so that natural sex drive just might not be there. Vaginal dryness is also a big problem. So if you really struggle with vaginal dryness, then sex isn't going to be pleasant. It could be really painful. So apart from not having any interest in sex, that can also really affect sort of relationships for you as well as for yourself, not understanding that process. Joint pains and muscle aches could be quite common, estrogen is very important in providing lubrication between our joints and preventing things like inflammation. So low levels of estrogen can play a part in really sore joints and achy bones and joints as well. Hair and skin changes, we already talked about estrogen and how that helps build the collagen up in our skin. So collagen is a protein that protects the structure of our skin and keeps our skin plump and youthful looking. Lower levels of estrogen can lead to a reduced elasticity of our collagen, leading to fine lines and, like I said before as well, very dry skin. Some women find the skin becomes very itchy, or they can develop like acne. So that's where the adult acne phases come from. Changing hormones can also make your hair thinner and less glossy, and you may notice some increased facial hair as well, sort of around the mustache area or the chin or anywhere really. So those are the things that can happen with these skin and hair changes due to the lower estrogen levels. If you do get migraines, people might find that their migraines are much worse. So migraines or headaches, you might have it more frequent, you might have it for much longer than normal. So again, talking to your GPs and making sure that you've got adequate support for migraines is really important, because a migraine in itself can affect your life in so many ways. And for some people, it's an afternoon in a dark room, and other people, it might be 3 days to get over that symptoms. Vaginal and urinary symptoms are quite common as well. So low estrogen can cause the tissue around the vagina to become a very thin, dry and itchy and inflamed, so not happy. This is known as vaginal atrophy or atrophic vaginitis. Your vagina also expands less easily during sex, making sex really uncomfortable and can be very painful. Low estrogen also thins the lining of the bladder, leading to an urge to urinate more frequently, again leading to maybe disturbances as you're trying to sleep. I've had friends and people that I've spoke to who sort of started wetting the bed and not knowing why that is happening, because they just don't have that, that urgency to go to the toilet, but the bladder control is just not there. Also, when you sort of sneeze or laugh or do something physical, you might find that you're wetting yourself. Your frequent urinary tract infections can be a sign and symptom as well of menopause. So if you really struggle with urinary tract infections and you're getting them quite frequently, please go and discuss that with your GP as well. So these are just a few common signs and symptoms that I'm talking through. But like I said, there's 30 known signs and symptoms, and they're all interrelated with this drop in hormone levels. So the long-term health problems which can arise from the menopause, we've talked about that during the session already. So bone health, so women can lose up to 10% of their bone strength within the first 5 years after the menopause. So estrogen helps keep our bones strong and healthy, but as this hormone drops, that's why the osteoporosis can happen. Other factors increase the risk of bone weakening are a family history of osteoporosis, or if you smoke, heavy drinker, and a slender body. So please, let's look after our bone health. Taking vitamin D supplements, you might need extra medication from your GPs to make sure that your bone health is healthy. Cardiovascular disease, so that's any heart condition or conditions that affect your blood vessels, and that can cause coronary heart disease or congenital heart disease, stroke, or vascular dementia. So estrogen looks after our blood vessels, and as that estrogen drops, our blood vessels are more inclined to get inflamed or not healthy, and we get a build-up of cholesterol in that can be quite risky, especially if you're through the menopause or postmenopausal. The risk of damage through high cholesterol in your body is much higher. So it might be that postmenopausal women take things like statins to help control their blood cholesterol levels to be more in a healthy range. And vaginal dryness and urinary symptoms can also be a long-term problem and really can affect your life. And these symptoms can appear during perimenopause and menopause and get to be more noticeable during menopause or the postmenopausal phase. So please talk to your GP if you have urinary tract or vaginal dryness symptoms to sort that out for you. It is an easy fix. Let's just look at some of the treatments for menopause. So HRT. HRT is a hormone treatment that includes hormones like estrogen, progesterone, and in some cases where a GP might even give you testosterone. So the most effective way to treat symptoms of the perimenopause and menopause is to replace those symptoms, those hormones that is decreasing as you go through the menopause. So taking HRT has other health benefits as well for those who and leads to lower risk factors for things like we talked about, the heart health, osteoporosis, lower risks of developing things like type 2 diabetes, depression, or even dementia in the future. So HRT not only helps you to manage those symptoms associated with menopause, but it can actually protect you as you move forward in your life to be healthy. So it can be preventative as well. So let's just look at these. So we've got estrogen. So estrogen replacing estrogen can be done in various ways. So there's various forms of estrogen replacement. So there's a patch that stays on. Normally you have to replace that every 2 times in a week. You get it in a gel form or a spray or even a tablet. So there's a variety of ways your body can absorb estrogen. Progesterone, if you still have a uterus or a womb, then you will need to take progesterone as well as estrogen. This is known as combined HRT. So if you have a coil, you might not need progesterone, so you only need estrogen. So your GP will know what is the best treatment for you. And then testosterone, if you're experiencing symptoms like fatigue, brain fog, and lack of libido, testosterone could be quite beneficial in addition to estrogen. It's not very commonly prescribed, but it's definitely something that you can discuss with your GP if you do feel like you still struggle with that fatigue and brain fog and lack of sex drive. It's available in gels, creams, or an implant. And while it's not currently licensed for women in the UK, it is still widely used. So please have that discussion with your healthcare professional. What's the benefits of HRT? Your symptoms will improve. People will start to feel like their old self. Your risk of developing things like osteoporosis will reduce because your bones are protected and because you're replacing that estrogen that's going. Your risk of cardiovascular disease will reduce, so therefore you're much less likely to develop things like heart problems, stroke, or vascular dementia. Your risk of other diseases will reduce as well, things like type 2 diabetes, osteoarthritis, bowel cancer, and some depressions. And it can help you to sleep and help you with your energy levels. So there's lots of benefits in having HRT, although there's a lot of press and bad press about HRT as well. That is all been proven to not be important, because the benefits of HRT really outweighs the risks of HRT. So there is reported risks. So the HRT may be associated with a very small risk of causing breast cancer. If you have a history of things like blood clots, liver disease, or migraine, there's a small risk of clotting if taking the tablet form of estrogen, but taking it through like a skin patch or a gel or a spray don't have that same risks. So really, estrogen is a really good, safe, and effective way of treating menopause. And I would highly recommend going to speak to your doctor about that if you feel like you are at that age where menopause is real for you. Just lastly, I thought I'll just touch on menopause and weight gain. Many women feel that their weight gets harder to manage as they get older in any case. We often approach menopause already struggling with our weight, and then it just gets even harder if you're going through that menopause and you have that drop in those important hormones. So fluctuating estrogen levels during the menopause can lead to the weight gain as it affects the way we store fat. This is because your fat cells can produce estrogen, which offers the body a safety net if it's running low on estrogen. So basically, our fat stores makes estrogen. So if your body in itself has a low testosterone level, your fat cells will give your body estrogen, and therefore it changes the way we store fat. So it wants to store more fat so we can make this additional estrogen. So low progesterone levels are linked with water retention, for instance. So this doesn't lead to weight gain as per se, but it does make you feel quite uncomfortable in your clothes. So around your waist, sometimes your wedding rings or your rings won't fit on your fingers because you feel quite swollen through water retention. And this comes and goes as well. So it seems to be a bit better in the morning and then worse as the day goes on. Testosterone may be higher at the start of menopause, and this will cause fat accumulation around the waist rather than the hips. So the way we store fat around the menopause is different. So if you've never had, a apple body shape, you might find that now you're getting an apple body shape, which could be quite uncomfortable for people. Another factor is an increase in our insulin resistance. Insulin resistance affects the way that our bodies store energy. So rather than burn calories, we're storing more calories. It also changes where we store fat, and normally, again, this is around the waist. So insulin resistance also encourages storage of fat around your waist circumference. So to give you an example here, if you eat 1,000 calories, your body will normally burn 700 and store 300. But when you're going through the menopause, it's almost the reverse of that. We find that people store more calories because your fat cells want to be there to produce more estrogen, and we burn less calories. So if we go back to that 1,000 calorie scenario, during the menopause, you might store 700 calories and only burn 300 calories, which again just encourages weight gain. Then last is that psychological impact of menopause. It can make us feel quite low. Eating something, especially something sweet and sugary, so carbohydrate-like food, can make us feel quite good for a moment or two. And so we might reach out for those kind of foods more often. It's also if our energy levels are low, if you're tired and you're not feeling great, you don't necessarily want to make a healthy meal. You want to maybe grab something that's quick and easy and perhaps much more calories than what you would have made for you or your family on your own. It also affects perhaps our physical activity levels. I certainly, when I started not feeling right, about 2 years ago, I used to be active all the time. It was either taking the dog for a walk or playing tennis, playing squash, going to do golf. And I did nothing of that. I just could not be bothered with anything. So my activity levels hugely fell because I just didn't have that energy to do even the things that I really love to do. I'll leave you with a fact really there, that evidence suggests that HRT does not lead to weight gain. So there's a lot of people that's really scared of starting HRT, thinking that that's the cause of weight gain, which hopefully I convince you to say that it's actually these fluctuating hormones that leads to the weight gain. A small number of women might develop fluid retention, especially if you're on progesterone as well. But this is normally transient, so it sort of comes and it goes. So it does disappear after some time. So that's really the end of this series of this webinar. So thank you very much for listening. I can see that there's quite a few chats going on. So I'll bring Stevie back in here just to see if there's any questions that I hopefully can answer for you. Otherwise, we will find it out and answer it after. Stevie, anything that you picked up?
Yeah, can you hear me, Twani?
I can, yeah.
Yeah, perfect. So yeah, I've got quite a few questions actually. There are quite a few questions around HRT. So Tracy's asked a question, which is, are there any herbal medications? But then Julie has asked a similar one, which is, what if you can't take HRT?
At the moment, I would not be promoting any herbal medication for menopause, just because there's not a lot of evidence to show that their effectiveness is the same as estrogen. So some people would have lots of estrogen in their diet that you can get through beans and sort of food. But if you are through the menopause, I would just recommend going to speak to your GP and finding a treatment that's evidence-based, that it actually works, rather than looking at herbal stuff that hasn't got that evidence. It's all about your life and your safety in the end, Stevie. I feel like, we know this estrogen levels drops. And if you don't put it back in a way that we know is actually true and it's evidence-based and years of research on it, then we might do ourselves more harm than good. So have that discussion with your GP. You might have some sort of natural treatments for menopause alongside a medical treatment for menopause.
Thanks, Twani. If we stay on kind of that theme around hormones, so Mandy's asked, if hormones are still very up and down, so i.e. they're in the perimenopause, is HRT still okay to take, or could it give you too much of different hormones at different times?
No, do you know what? The earlier you start on HRT, the better for you. As these estrogen levels start to drop, they keep on dropping, and they start to drop in perimenopause, so early menopause, perimenopause. The quicker you start to put those hormones and that estrogen back into your life, the less risk you have with the cardiovascular disease risk and osteoporosis risk factors, and the better your symptoms can be managed, even maybe before they happen. So I never had hot flushes, for instance, but I know that the HRT that I'm on now prevents me from having that, because I'm actually putting that estrogen back into my body before it fell to absolutely rock bottom levels. So yeah, the GP will decide when's the best time, but I would say it's never too early, but it can be too late.
Thanks, Brian. Somebody else has asked, or just said that they find that there's so much stigma around menopause. What would your advice be on how to best tackle or approach this with your employer? So, for example, if your symptoms persist and it affects your ability to work, have you got any advice around that?
Do you know, I would advise you to go and look at some of these websites that we've put in our chat. There's a big drive, even in the NHS, around workplace support for people on menopause. I will perhaps take my employer, or I will go to HR, ask you to go and speak to your HR department about it, so to say, how can I get the appropriate support, especially if your manager or your managing team or your team don't understand menopause or don't see it as something that should affect you in the way that it does. And it really can affect your work life dramatically. You know, you might overnight turn into someone that they don't recognize. So please look at the websites that that we've put in the chat. There is lots of advice there around how to have that conversations, which could be a difficult conversation with your HR team or your manager around supporting you through the menopause, because it's really a win-win situation. If they support you in the right way, they'll also get the best out of you at work. So, and I think that's always how you can spin that to your managing team or your team or manager. So it's not something that you should be ashamed about, or that you should try and hide, or that you should just put a brave face on and crack on. You know, menopause is real. It's not something we've made up. Sometimes I joke with saying if men went through menopause, we probably would have had treatments 50 years ago. And I'm sorry if that's stigmatizing men, but it could, for me, it feels true, because we were, 50 years ago in the kitchen making food and raising our kids, when now we are professionals and you do have a work life. And I think standing up for yourself and going to your manager with evidence is really important. But it's really encouraging, really, that the NHS is taking this serious, and there will be nice guidelines produced about workplace support for people in menopause. So watch this space. It is definitely on the radar for everyone.
Thanks, Rani. Another question there is, am I doing myself harm by going cold turkey, as in they're not taking a HRT?
Yeah, I hope I answered that through this presentation. Going through the menopause isn't something that you just grit your teeth and you go through, and at the end of it, you'll be all right. It is a physiological changes that's happening in your body with really important hormones, especially estrogen. I can't stress enough, estrogen is everywhere in our bodies, from our hair to our nails, eyes, intestines, liver, heart, brain, everywhere. If you haven't got estrogen in your body, you're causing damage. So going to cold turkey feels like it should be the brave things to do, but it's actually causing you harm. So if you feel like you've got symptoms of menopause, or you're at that age where menopause is common to start happening, please don't go cold turkey. Go speak to someone about what's the best treatment for you.